Tim Burton, Michelangelo, Andy Warhol, Steve Jobs, Mozart. What do all these successful people have in common? They all have some form of autism spectrum disorder. Most of you guys would not have guessed this, considering there's still plenty of negative stigma surrounding autism spectrum disorder. Furthermore, this is supported by an article titled Felt and Enacted Stigma Among Parents of Children with High-Functioning Autism, published on October 2002 by David Gray, where he states how the results of his study indicated that a majority of parents experienced stigma, which included avoidance, hostile staring, and rude comments from others. Autism spectrum disorder is not a highly talked about topic, so I'll present some of the basic information of it. A lot of you guys may not have full knowledge of what ASD, autism spectrum disorder, is, and that's understandable because unless it was something that was taught to you in a classroom or something that's personal to you, I see why people wouldn't go out and do their own in-depth research about it. So that's why I will present what it is and some of its basic information so you guys can have a better understanding. I will now proceed to define what ASD is, the signs and how it's diagnosed, as well as some of the treatments that are used to help with the symptoms of ASD. I'd like to start off by informing you guys on what autism spectrum disorder is. In a handbook of developmental psychiatry by Hans Steiner, published in 2011, it is described as a brain development disorder that disrupts the way a person perceives and socializes with others. Along with this, it's also characterized with difficulties with social interaction, whether it be verbal or nonverbal. And then they also have unusual or repetitive behaviors, and it just varies in degree. So like stated in the name, autism is a spectrum, and there's different levels within it, and each level determines the severity of it. So there's level 1 through 3, level 1 being the one that is manageable but requires some help, and then level 3, when it gets to level 3, that is requiring more full-time care. It's on the more severe end. So all the levels have some form of difficulty with interacting or communicating with others, and then for level 2 and 3, that's when they have trouble with verbal and nonverbal communication. So there's also names that go along with the severity of ASD. There's Asperger's syndrome, which is on the mild end of ASD, and people with this can be highly intelligent and they can manage their daily life, but they do have some social challenges. And then there's pervasive developmental disorder, which is on the more intense side of ASD, and people with this have social and communication challenges. And then when it gets to autistic disorder, that is on the more severe end of ASD. And with this one, they have significant language delays as well as social and communication challenges. So that's just a basic understanding of what ASD is. I will now proceed to explain some of the signs and symptoms that are seen during infancy and early childhood, and as well as how it's diagnosed. So there's a wide range of signs seen during this stage that have to do with communication, social skills, and unusual behaviors or interest. So to start off, some of the signs that have to do with social skills include avoid eye contact, they prefer to play alone, they don't respond to their name by 12 months, they have flat or inappropriate facial expressions, and they also tend to have trouble understanding other people's emotions. And then when it gets to communication skills, that includes delays in speech and language skills. They use few or no gestures, they repeat words or phrases over and over, they don't pretend play, and then they also talk in a robot-like voice. And then with unusual behaviors or interests, the interests can range to obsessive. And so some of this can be like following a certain routine before they go to bed or after they get home from school. And they also play with their toys the same way every single time. And with unusual behaviors, that's more with having to do with like flapping their hands, running in circles, or walking on their toes. So the signs that are presented in children also have to do a lot with the diagnosing process, because the doctors do two tests, the developmental screening test and then the comprehensive diagnostic evaluation. So for the developmental screening test, that's a short test that helps the doctor identify whether the child is learning basic skills at the level it should be or if it's delayed. And then they'll also ask the parents questions and talk or play with the child. As for the comprehensive diagnostic evaluation, that one must at minimum include a parent interview and an observational assessment of the child's current functioning by an experienced clinician in a context in which social communicate, behavior, and player-peer interaction can be observed. And this is stated in an article titled Diagnostic Evaluation of Autism Spectrum Disorders by Marisela Huerta and Catherine Lord. And then they also might have any neurological testing done. So once ASD is diagnosed, the last important information is the treatment that is used to help with the signs presented by ASD. So I'd like to start off by saying that when it comes to autism spectrum disorder, there's no medication or treatment that cures ASD. People with this have it for the rest of their life, but the medication and therapies are used to help them manage their symptoms. For example, there's applied behavioral analysis, which is a notable treatment for people with ASD, and it's used by many health professionals and in many schools. The goal of ABA, applied behavioral analysis, is to increase behaviors that are helpful and decrease those that are harmful or affect their learning. In an article titled Applied Behavioral Analysis, published by Medical Necessity Criteria Committee in 2011, it stated that ABA was effective in producing sustained gains in IQ, language, academic performance, and adaptive behaviors, as well as some measures of social behaviors. Along with this, there's also other therapies that help with emotional and relational behaviors. One of these can include occupational therapy, which teaches them skills so that they can live individually. And then there's speech therapy, which obviously helps them with their communication skills. Like stated before, such therapies don't cure autism spectrum disorder. It only helps the person with their social and communication challenges so that they can manage their daily life. As for those on the more severe end, they'll require full-time care as well as some of these therapies. And then it goes the same for medication-wise. It does not cure it, only help those with ASD with any hyperactivity, obsessive-compulsive disorders, or depression that they might have, and this will be recommended by medical professionals. So all in all, autism spectrum disorder is very complex and requires one to go in depth to have all the information, but this is just to give you guys a basic understanding of what it is and how people can present signs of it. In review, we learned what autism spectrum disorder is, some of the signs and how it's diagnosed, as well as some of the therapies and medication that are used to help with autism spectrum disorder. Many people can have different levels of ASD, but it is helpful for those with ASD to have others knowledgeable of what it is so they can be better understood. Autism spectrum disorder is not something that can be seen just by looking at someone. And because of this, people may have negative attitudes to those who do have it. But by having a better understanding, it can help those with it and those that don't know what it is be more understanding and be more patient to those that are dealing with autism spectrum disorder. That is it. Thank you.